You take your socks off at the end of the day, and there they are, deep red lines pressed into your skin where the elastic used to be. Your ankles look like they belong to someone 20 pounds heavier than you. And by morning, somehow, almost like magic, it's gone. Your feet look normal again, until tomorrow night, when the exact same thing happens all over again. If this sounds familiar, you've probably already been told it's just circulation or just part of getting older. And sometimes that's true. But sometimes that nightly swelling is your body's way of flagging something specific about your heart, your veins, your kidneys, or even a medication you're already taking, long before any other symptom shows up. In the next 20 minutes, I'm going to walk you through exactly why this happens, how to tell the difference between the harmless, everyday kind of swelling and the kind that deserves a phone call to your doctor, and what you can actually do about it tonight. Let's start with what's actually going on inside your legs when this happens. To understand why your feet swell specifically at night, and specifically after 60, you have to understand a little bit about how fluid moves through your body during the day. Every day, fluid naturally seeps out of your tiny blood vessels into the spaces between your tissues. This is normal and happens to everyone. Your veins and your lymphatic system are responsible for collecting that fluid and returning it back toward your heart. But your leg veins have to do this job working directly against gravity, pushing fluid upward against its natural pull downward. The way your body normally manages this is through two main systems. First, one-way valves inside your veins that act like tiny gates, letting blood flow up toward the heart and snapping shut to stop it from falling back down. Second, the muscles in your calves, which squeeze those veins every time you take a step, acting almost like a secondary pump. Here's where age changes the picture. Over years, those one-way valves can weaken and stop sealing as tightly as they used to, a condition called venous insufficiency. At the same time, many people become less active as they get older, which means that calf muscle pump isn't working nearly as often throughout the day. Add these two things together, weaker valves, less walking, and fluid has an easier time pooling in the lowest point of your body by the end of the day, your feet and ankles. By nighttime, after a full day of sitting, standing, or simply being upright, gravity has had 12 or more hours to work against weakened return systems. That's why the swelling is often barely noticeable in the morning and quite noticeable by evening. And why, once you lie down to sleep, with your legs finally horizontal instead of vertical, your body gets the chance to redistribute that fluid back through your system overnight, which is why it often looks better again by morning. Let's go through the causes that are usually harmless, the ones most likely behind occasional evening swelling in an otherwise healthy person. Prolonged sitting or standing is the most common cause by far. If you spent the day in a car, on a plane, gardening on your feet, or sitting in a recliner without moving much, that's often explanation enough on its own. Salt intake plays a real role, too. Sodium causes your body to retain water, and a saltier meal, restaurant food, canned soups, deli meats, processed snacks, can show up as visible ankle swelling that same evening or the next day. Heat is another major factor many people don't connect. On hot days, your blood vessels naturally widen to help release heat, called vasodilation, and that widening makes it easier for fluid to seep out into surrounding tissue. This is why summer swelling is so common, and often resolves on its own once temperatures drop. And simple inactivity, even without obvious prolonged sitting, contributes too. If your daily walking has gradually decreased over the months or years, that calf muscle pump we talked about is getting less of a workout than it used to. If your swelling fits this pattern, both feet roughly equally, worse by evening, better by morning, tied to a hot day or a salty meal or a long car ride, that's usually the everyday, low concern version. Worth knowing about. Worth addressing with the habits we'll cover later in this video, but generally not something to panic over. Now here's a cause that surprises a lot of people because it has nothing to do with circulation at all, and everything to do with what's already in the medicine cabinet. Certain common medications list ankle and foot swelling as a known side effect. Calcium channel blockers, a class of blood pressure medication, are particularly well known for this. The swelling happens because these medications widen blood vessels, including the small vessels in your legs, in a way that can allow more fluid to seep into surrounding tissue. Certain medications for diabetes, called thiazolidinediones, are also recognized for causing fluid retention in some people. And anti-inflammatory pain medications, the same NSAIDs we've discussed on this channel before, can cause the body to retain sodium and fluid as a side effect, showing up as ankle swelling, especially with regular use. The reason this matters so much is that this type of swelling is easy to misread as just aging or just circulation, when really it's a direct, fixable side effect of a specific prescription. If your swelling started or noticeably worsened around the same time you started a new medication, that's an important detail, and one your doctor genuinely wants to know. Because in many cases, there's an alternative medication available that doesn't carry the same side effect, or your dose can simply be adjusted. What to ask your doctor? Simply mention the timing. My ankle swelling seemed to start around the time I began this medication, and let your doctor connect the dots from there. Now we get to the part of this video that matters most, because this is where evening ankle swelling can be an early, genuinely useful warning sign rather than just a nuisance. When the heart's pumping ability weakens, a condition broadly called heart failure, blood can back up in the veins leading back to the heart, and that backup raises pressure in the leg veins, pushing fluid out into surrounding tissue more than usual. This swelling tends to look a bit different from the everyday kind we discussed earlier. It's often present in both legs, but tends to be more persistent, doesn't fully resolve overnight the way ordinary swelling does, and is frequently accompanied by other clues: shortness of breath, especially when lying flat or during mild activity that didn't used to cause it, unusual fatigue, a noticeable, rapid weight gain of several pounds over just a few days from fluid retention, and sometimes a new or worsening cough. I want to be careful here, because I'm not trying to send everyone watching this into a panic about their heart because their ankles looked a little puffy after a long flight. The distinguishing feature is the combination: swelling that doesn't fully go away by morning, paired with breathing changes or unusual fatigue. That combination is what deserves a prompt call to your doctor, not next month, but soon. A related but distinct cause involves the leg veins specifically, rather than the heart. Chronic venous insufficiency, the weakened one-way valve condition we touched on earlier, can become significant enough to cause its own symptoms beyond simple swelling, including visible varicose veins, a brownish discoloration of the skin around the ankles over time, and in more advanced cases, skin changes or slow-healing sores near the ankle. A more urgent version of a vein-related concern is swelling that's significantly worse in one leg than the other, especially if it comes on relatively suddenly, and especially if it's accompanied by pain, warmth, or redness in that one leg. This combination can, in some cases, be a sign of a blood clot in the deep veins of the leg, a condition called deep vein thrombosis, which is genuinely a same-day medical concern, not a wait-and-see situation, because of the small but serious risk that a clot could travel to the lungs. This is the single most important distinction in this entire video, so I'll repeat it clearly. Swelling in both legs, gradual, worse by evening, better by morning, is usually the harmless, everyday kind. Swelling that's new, sudden, and clearly worse in one leg than the other, especially with pain, warmth, or redness, needs medical attention the same day, not after watching the rest of this video. Two other organs are worth a brief mention, because they connect back to topics we've covered on this channel before. When the kidneys aren't filtering and balancing fluid properly, excess fluid can accumulate in the body, often showing up first as swelling around the ankles and sometimes around the eyes in the morning. This is part of why kidney function blood tests, the same ones we discussed in a previous video on medications, are such a useful, simple thing to have checked periodically. The liver, similarly, produces a protein called albumin that helps keep fluid properly balanced inside your blood vessels, rather than leaking into surrounding tissue. When liver function is significantly impaired, lower albumin levels can contribute to fluid pooling in the legs and sometimes the abdomen. Neither of these is meant to alarm you. For most people with occasional evening ankle swelling, the cause is one of the everyday, harmless reasons we covered earlier. But if swelling is persistent, gradually worsening over weeks, or paired with other symptoms like reduced urination, unusual fatigue, or abdominal bloating, it's a reasonable and easy thing to mention to your doctor, who can check it with a simple blood test. Here's a simple way to keep track of this at home, without needing any special equipment. Each evening, press your thumb firmly into the skin above your ankle for about 5 seconds, then release. If the skin holds a visible indentation for several seconds afterward, that's called pitting edema, and it's a useful, objective way to track whether swelling is present and whether it's improving or worsening over days and weeks, rather than relying on memory alone. Pair that with a simple daily note: which leg or legs, how it looked compared to yesterday, and whether you noticed any shortness of breath, chest discomfort, or unusual fatigue alongside it. If you ever do need to call your doctor about this, having even 3 or 4 days of simple notes like this makes that conversation far more useful than saying, "My feet have been kind of swollen lately." For the everyday harmless type of swelling, there are some genuinely simple habits that help most people. Elevating your feet above heart level for 15 to 20 minutes in the evening uses gravity to help fluid drain back out of your lower legs. Walking regularly throughout the day, even short, frequent walks rather than one long one, keeps that calf muscle pump working. Reducing sodium from processed and restaurant food makes a noticeable difference for many people within just a few days. Compression socks, the kind that gently squeeze your lower leg, can meaningfully support vein function for people who are on their feet a lot or sit for long periods, though it's worth getting properly fitted ones rather than guessing on sizing, since too tight can be counterproductive. And staying well hydrated, which sounds counterintuitive, actually helps, because dehydration can cause your body to retain sodium and fluid more aggressively as a protective response. Your feet are about as far from your heart as any part of your body gets, which makes them one of the first places fluid tends to show up when something in the system needs a little extra help. Sometimes just from a long day on your feet, and sometimes as an early signal worth paying attention to. The goal of this video was never to make you afraid of your own ankles. It was to give you a clear, simple way to tell the difference between "this is just a long day" and "this is worth a phone call," so you can act with confidence either way. If you found this useful, give the video a like and subscribe for more clear, honest senior health guidance every week. If you've noticed this pattern yourself, let me know in the comments what helped you. I read every one, and your experience might be exactly what someone else watching this needs to hear. I'll see you in the next video.